Hello everyone, this lesson is about emergency triage, assessment and the treatment of sick children. This is a part 1 of it. On this part, we'll discuss on a triage and we'll discuss assessment and the treatment on the next lesson. In many hospitals, children are not checked before a senior health worker examines them. As a result, some seriously ill patients have to wait a very long time before they are seen and treated. Many days in hospital occur within 24 hours of admission. Many of these days could be prevented if very sick children are identified soon after their arrival in health facility and treatment were started immediately. Therefore, a process of rapid triage for all children presenting to hospital needs to be put in place to determine whether any emergency or priority signs are present. Triage is the sorting of patients into priority groups according to their needs and the resource available. Triage is a process of rapidly examining all sick children when they first arrive in hospital in order to place them in one of the following three categories. If there is emergency sign, start emergency treatment. If there is no emergency sign, check for priority sign. And if there is priority sign, rapid assessment and attention. And if there is no both emergency sign and the priority sign, the patient should have to wait their turn. Those with emergency signs requiring immediate emergency treatment do the following immediately. If there is emergency sign, start to give appropriate emergency treatment. Call a senior health worker and other health workers to help carry out emergency laboratory investigations. Those with priority signs indicating that they should be given priority in the queue so that they can rapidly be assessed and treated without delay. Those who have no emergency or priority signs and therefore are non-urgent, or their patients assigned as queue and can wait their turn in the queue for assessment. Triage should be carried out as soon as a sick child arrives in health facility, well before any administrative procedure such as registration. This might require reorganization of the flow of the patient in some location of the hospital. All clinical staff involved in the care of sick children can triage. If possible, all such staff should be able to give initial emergency treatment. Triage of patients involves looking for signs of serious illness or injury, or emergency signs. This brings the ABCDO concept. In the ABCDO concept, A stands for airway, B stands for breathing, C stands for circulation, coma and convulsion, D stands for dehydration and disability, O stands for other such as immediate poisoning, major trauma with open fracture and a bleeding child. When we see the emergency signs include obstructed or absent breathing, severe respiratory distress, central cyanosis, signs of shock, coma, seizing child, signs of dehydration, disability like motor deficits, and other emergency signs such as bleeding child, poisoning, and major trauma. Bleeding can be due to trauma or spontaneous bleeding, and immediate poisoning, which can be acute eye or skin poisoning, or ingested poisoning within 1 hour. And also, compound fracture is an emergency sign. Those are emergency signs. The next is, if there is no emergency signs, check for priority signs. These signs can be remembered with the symbol 3TPR MOB. 3T stands for tiny baby, those less than 2 months, temperature, and the trauma. Temperature is a child whether they are cold or hot, and also trauma or other urgent surgical conditions, which doesn't fulfill emergency sign. 3P is pallor, poisoning, which doesn't fulfill emergency care and pain. And 3R stands for respiratory distress, restless, or lethargy, and referral or urgent cases. MOB stands for malnutrition, such as visible severe wasting, edema of both feet, and burns. When we see the triaging process, for a child who does not have emergency signs, it takes on average 20 seconds. The healthy worker should learn to assess several signs at the same time, such as look as a child, observe the chest for breathing, and priority signs such as severe malnutrition, listen to abnormal breath sounds such as stridor or grunting. Colors can also be used in differentiating the three groups. Red distracts or shows emergency sign. We can also give yellow for priority and green for the queue. So when we receive the sick child in hospital, always first we should have to check for emergency sign before any registration or any further administrative procedures. Check for emergency signs. If there is emergency sign, as I have said above, send the patient to the emergency and start emergency treatment. Start management immediately. If there is no emergency sign, check for priority signs. Priority signs are checked by 3-TPR remove. If there is priority sign, send the patient to the priority as OPD or in front of the queue. If there are no emergency and the priority sign, the patient should have to be sent to queue and they should have to wait for his or her turn in the list. This is all about triage. On the part 2, we will see about emergency management of triaged children. Thank you for watching.